All right, it's a little past the 10 o'clock hour, so we'll go ahead and get started. Thank you for joining us today for our continuation of our sessions. And we'll start with opening remarks by our Minority Leader, Anthony Dean.
Thank you, Katie, and thank you for those participants from various organizations. I see that we have a representative from AARP, Ms. Anna, Commissioner Brown, and from the Legacy Center, we have Ms. Crutcher. And so thank you guys for participating today, and thank to all of the viewers that are viewing from via Facebook Live. As well as those that are present on the webinar. And thank you for to the media for those individuals that are covering it either Facebook Live or actually on the webinar. This is a very important session. Certainly like to thank our staff for doing such a wonderful job of putting these together for us and the members for their participation. And without further ado, I guess I'll turn it over to the co-chairs. Representatives England and Hall.
Good morning, everyone. We are delighted that you've chosen to spend time with us this morning. We're excited about the panel that will be presented to us today. We certainly do appreciate the leadership of Leader Daniels, and I am always honored to serve in a capacity with Representative England. So I will give him an opportunity to say a few words, and we will begin the process. I am very pleased that we also have one of my favorite people as a part of this panel, Ms. Chanda Crutcher, and is always honored and pleased to see the work that she has done and continues to do for our seniors. Even though I'm the mature millennial in the group. But thank you so much. All right. Representative England.
Good morning. These last few days, I've enjoyed this opportunity to serve as a co-chair with you, and also honored to be a part of this conference that is undertaking this task of making sure that people stay informed. And I also want to stress that, and I think just because people are seeing these people reopening and all that kind of stuff, that we're still in the middle of this crisis. We have not reached a plateau yet, and things are continuing to kind of spiral. So it is with that, we have a very important panel today to discuss the community of our Alabama citizens that are basically in desperate need, as you see across our state, and the different benefits and the lack of health care. So I'm just happy to be here, and Representative Hall, I'll let you get us started.
All right, so we are honored and indicated that we have a panelist that really can give us a good idea of what it's like to be a senior, I think is where we want to start. And so I would ask Ms. Crutcher if she would go ahead and begin the process, and then we'll
Yes.
All right.
Okay, thank you. Good morning again. Just to give a little background, we started the first week after the stay-at-home order was issued to figure out ways that we could physically distance ourselves but stay connected with the older adults. And so we started with well check calls. And what we realized is that there was a lot of fear. But the more practical needs that we identified was that we had restricted visitation to seniors in our independent living housing. And that's where I'd like to focus my few minutes this morning, are those seniors that live in independent living subsidized housing. What we have found throughout this, and we kind of knew it a little bit going in, but we really saw it in the midst of this pandemic, is that those seniors that are in independent living subsidized housing, The only reason that they're not in assisted living is financial, many, many times. So they had extreme needs in these housing complexes, but visitors were restricted and they were told not to leave. And so we decided to gown up, glove up, PPE up, and take as few people as possible, but those that were trained on COVID and infection control. And we went door to door and began knocking on doors that second week to just say, are you safe? Do you have food? Do you have your medications? Because again, we've kept visitors out. We've told them not to leave. And so we have been feeding, we started out feeding about 65 a week. We picked up a second building that took us 200, and now we're up to almost 400 a week that we're feeding in subsidized senior living apartments. We've been able to provide everything from hospital beds to wheelchairs. And so what we are seeing is three main issues that need to be addressed. And that's how we handle when the recommendation is social distancing. How do we stay connected with those very vulnerable populations, specifically that are living independently, but also in facilities? Because as we all know, part of the accountability piece is being able to lay eyes on our older adults that are institutionalized. And so how do we stay connected, but also keep them safe? Number two, many of the seniors that we encountered, they were receiving $15, $20 in food support, and food stamps only pays for food. And so we learned that taking canned goods and things like that and not ensuring that they had can openers or pots or even a microwave to warm up. And so we had to kind of broaden our support because food stamps only pays for food. And many of them in the beginning, they were only getting 15, 20. And then so many, the third thing was 99% of the people that we surveyed did not have access to the internet. So if they were getting very minimal information about COVID, they aren't getting the updates. They weren't able to communicate via the internet to request a stimulus check if they didn't file their taxes, which most of them didn't, and some weren't getting Social Security, and they were just in this dark hole. And so those are the three things that I'd really like to highlight is the potential for a social recession that can come when we have social distancing, which is very necessary, but just thinking outside of the box when it comes to those older adults that already have minimal support. Number two, the basic need for nutrition and nutritional support outside of food. And then number three, how we communicate and how we've been able to stay connected with the internet and other technology. We definitely cannot assume that our older adults can get their information the same way. So we've had to go to the pen and paper and taping things to the doors and just making sure that they stay connected. And I could go on for hours about the feedback that we've gotten as a result of that, but I'll just leave it with those three major observations.
And thank you for that. Now we'll go to our commissioner of the Alabama Department of Senior Services. Could you introduce yourself and kind of identify some of the issues that you've seen since this crisis has begun?
Yes, thank you so much. On behalf of Governor Kay Ivey and our team here at the Alabama Department of Senior Services, I first want to let you know how very much we all appreciate the opportunity to be here and discuss the issues, many of which are unique to our elder citizens. I'd like to also say good morning to Representative Daniels and Representative Hall. I'm sorry we can't be together, but this is the next best thing. There have been a number of issues that we had to address immediately here at the Alabama Department of Senior Services. My first immediate concern, the first week of the stay-at-home order, was how in the world are we going to ensure that our seniors continue to receive their meals? As y'all know, in the past, many seniors were able to come to senior centers and receive nutritious hot meals many times during the week. And one of my favorite parts of my job was visiting those senior centers because number one, I'm acutely aware that those meals may be the only nutritious meal that that senior is receiving that day, but equally as important is the social interaction and talking with friends. I've been to senior centers, some of them, I've been to one in Huntsville that teaches the Russian language. Some have ballroom dancing, they play cards. So I personally experienced the joy that our seniors have derived from going to their senior centers. And so I'll first talk a little bit about our meals, and then I'll get into the social isolation issue. As I said, my immediate concern on day one was we've got to ensure that nobody goes hungry. Due to my demographic, it's extremely easy for me to put myself in the shoes of a senior, and I always think this might be the only hot meal, the only nutritious meal I'm receiving today, and it's extremely important to me that we never drop the ball on the meals. And so at that time, we were fortunate to have 3 registered dietitians on our staff here at ADSS, and we immediately got to work in conjunction with our food vendor to assess how we were going to now, instead of having congregate meals, we would have the ability to deliver drive-through meals. Either seniors could come to the center. Now, the governor's order, of course, closed all senior centers for public programs, and that part of the order still remains in place. There's been no change for congregating at senior centers right now, but some seniors are able to come to the senior center, do a drive-through, receive their hot meals. For others, for the homebound, we can deliver hot meals. Now, there are 2 other options, but in my lingo, the hot meal is the gold standard for senior nutrition. After the hot meal would come a frozen meal, because as Chanda said, if you have the ability to heat it up, at least if you cook your meal, then you're still getting a hot meal. The third choice and the last choice, but it works during an emergency, would be your chef stable meals, which are simply canned goods, maybe some applesauce in a plastic container, that sort of thing. So I'm happy to report, let me explain, we have 13 area agencies on aging in Alabama. Those 13, what we call AAAs, serve every county in the state. And currently 5 of the 13 never stop serving the hot meals. So I thought that was a good statistic during these challenging times. But I'm also happy to report that the senior centers are beginning to move back to hot meals. So that's one item of good news I want to report. And like Chanda, I could talk for a very long time about our seniors and their needs and what we can do. But a second thing I want to talk about is the issue of isolation. According to the statistics I've seen, I think we're now up to a little over 400 deaths from the COVID-19. And almost 80% of those deaths have been those 65 and older. So knowing that fact, I think we can all agree that the elderly represent one of the most vulnerable segments of our population. But unfortunately, all the ways we are protecting them right now, or I say most of the ways, involve isolation. For example, if you have to go to the hospital, you can't even have a family member present. If you are in a nursing home, segments of our I'm sorry, I couldn't. There may have been some feedback, but and then of course the senior centers being close to the public, all those represent isolation, and all of us present today know that isolation can be very deadly for seniors. The latest statistic I know of is that it's more deadly than smoking 15 cigarettes a day. And so that's one of the issues that I'm striving to do something about, is the isolation. And I want you to know that in the beginning, from week 1, we started weekly phone calls with all of our AAA directors so that we can find out what they need and how we can help them. Those calls have led to one thing, we're looking to provide PPE, perhaps get a bulk order so that we save on that. And then we're also working with them on, well, for example, this month is Older Americans Month. This time last year, we were having wonderful picnics all over the state, and the seniors love those. And so now we're having to look for other ways, since we cannot do in person without social distancing. We're looking at other ways to help prevent social isolation. And our AAAs have come up with wonderful plans to highlight seniors. They're doing social media for those who have access to that, and they're being very creative. And then I will close in my opening remarks, which have been quite lengthy, and y'all excuse me, but I'm just so enthusiastic about everything we do here. But the final thing I'll talk about in my opening remarks, I have learned that in New York and the state of Florida, they have done surveys and have learned that robotic pets can greatly reduce loneliness and sadness, both in people with dementia and people who are lonely. And so we just got a new federal grant from the Administration for Community Living, and I have set aside a small amount. It won't buy a lot of pets, but we will begin a pilot project with all of our AAAs so that every county can try this out. But we are going to pilot these robotic pets. I have 2 at my house. I've tried them out. There's a dog and a cat. And if I learn, as I have learned, that these pets can reduce loneliness, the feeling of isolation, sadness in seniors by up to 70%, then I think that is money well spent. So again, I will close, and as we go along, I'll be happy to try to answer any questions, but thank you so much.
Thank you, Commissioner. So the next person, thank you, Commissioner. So the next person
Yes,
we will hear
ma'am.
from will be Ms. Williams from AARP. Will you share with us the challenges that you've seen during this time? And then after you've completed your time, we will open it up for questions.
Thank you, Ms. Hall. This is Anna Pritchett. I'm sitting in for our
Oh, Anna.
director.
Okay. Hey, Anna.
Hey, Ms. Hall. Thanks for having me. Candi wasn't available today, so she asked me to stand in. It's good to see everyone, even if it is virtually. We're getting used to the new norm, I guess, and good to see the commissioner. She's done an outstanding job working with in a very hard environment with the AAAs. We're very proud of the work they've been doing, and Chanda is always a great resource. I'm glad to have both of them on to carry forth their messaging, and we're happy to support as well. AARP has about 4,000 members in the state of Alabama, and what we have been working on is making sure that we are getting out the information people need, connecting them with resources, and then of course advocating on their behalf with you guys and our other elected and officials, as well as the leadership, to talk about the things that we're hearing about. We've heard a lot about what my colleagues here on the call have listened to, and I have to agree. The isolation issues, hunger issues, of course, have come to the forefront. We are talking a lot about supporting caregivers and how to make sure that they're taking care of themselves as well as the person they're taking care of. How do they have a plan? What they will do if they get sick, and how do they plan to take care of their loved ones if they are sick, and as well as themselves, of course. The struggle with communicating with our seniors. We've been hosting a lot of teletown halls, as y'all know, so that they are live cast on the internet, but as well, we've called out to thousands and thousands of seniors in the state, trying to make sure that they have the resources and to listen to them. Commissioner was actually on our first one, so Those have been very successful, and we have been trying to do one in the state probably every week. And then, of course, our national office is getting national experts on every Thursday. Y'all are welcome to attend. We're getting our information out a lot through social media and connecting with a lot of family caregivers to make sure that they're connected, and working a lot. We are seeing a lot of information come forward about possible fraud and financial exploitation. I think that's a resource that we have that's been high in demand. You know, anytime that that criminals can take advantage of folks, we see that, you know, new and different ways to take advantage of people every day. So we have a lot of resources for folks to protect themselves and ways, and making sure that they're getting their information from credible resources. We have been working on getting information lately. We're getting a lot of stories from folks like Chanda about people's struggles in the community, as well as the caregivers' frustrations with not being able to get enough information, or feeling like they're too disconnected from the loved ones in nursing homes. I think that's been an issue we've all seen quite a bit. We've been trying to support people in how to ask the right questions and figure out what they need to do with their family members in the nursing homes. I know that the nursing homes have been working very hard, but it's a lot. And I hear a lot about PPEs on a regular basis, and then knowing that they're getting the right information. I think that's where we're focusing right now.
Thank you. And I thank you appreciate you being here in your presentation. So now we're going to get into the questions. And I think I'll go ahead and throw one out there for everybody on the panel. As you see, we're beginning to reopen, and depending on your perspective, maybe prematurely putting people at risk. But as we start this reopening process, for each panelist, what do you see as the main challenge going forward as we start opening businesses, potentially looking at reopening senior centers and other things as we make this transition back to opening our economy? So anybody can open up, answer that question if you like.
I can tell you that the one thing I've seen almost immediately, and it started on Monday, I guess yesterday, and over the weekend, I think that as people feel safer themselves, they're not taking into consideration what they could be transmitting to those who are vulnerable. So if they feel comfortable not wearing a mask, or that if they have a personal conviction that a mask is contraindicated, then they don't feel like they should wear masks going in and out of these facilities. So we had to deliver a few crises things over the weekend, and I noticed a lot more traffic in and around the senior communities that were not masked. They weren't using the hand sanitizer stations as much going in and out because they're feeling safer. And so I just think any reminder that we can give that it's not just about us as individuals, but it's about those that we can protect, and using the proper PPE. And I think a lot of people just don't have it. We've been delivering masks every week, and every week we're delivering masks. So, you know, people still need a lot of PPE, and it is very difficult to find. But the combination of those two things, I think we just need to really make sure that as churches are reopening and volunteers are wanting to get more engaged, we require all of our volunteers to go through COVID training. They have to mask up, they have to glove up. The community that we're about to go to here in about 30 minutes, we're wearing gowns because they're positive COVID tests in that independent living high rise. And so people, the fact that people feel safer, which is good, is a good thing, but we can't let it be negligent when it comes to keeping our seniors safe.
Commissioner, do you have any thoughts on that?
Yes, sir. I'd first like to say that along with Representative Hall, I had the chance to visit the Legacy Center and see the terrific things that Chanda is doing. And she just has a heart for protecting and loving seniors and their families. So I would just like to tell her how much we all appreciate the important
Thank
work
you.
they're doing. I've always thought, as I tell my little granddaughter who's 5, and she asks me regularly, because I'm very careful when I'm around her. She asks me regularly, when is the virus? And she wants a month. Will it be May, June, July? And I always tell her, we have to be smarter than the virus. And as y'all will recall, even in her last press conference, the governor stressed that the virus is still there, it's still deadly. But I am encouraged. I know at University of Alabama at Huntsville, I recently read that that school has partnered with the Oak Ridge National Lab, and they're using the most powerful supercomputer on the planet, and they're running virtual test tube lab tests, a few million a day. And so realistically, I'm looking forward to the time when we either have a vaccine, and I know the world's attention is focused on that, either and or a vaccine or a treatment for COVID. And when Chanda refers to people not being careful, if y'all are reading the same stories I'm reading, we know that the disease can be deadly for young children. It can cause strokes. Age is not the only thing. And some of these terrible things are happening to people with no known risk factors. But until we have a treatment and or a vaccine, it's my belief that senior centers will most likely be some of the last to reopen. Although I do want you to know, I've already heard from the Administration on Community Living some thoughtful, innovative ways we might go back to the senior centers and yet protect our seniors. Perhaps having little cafes that aren't 50 people in one room. So they are looking at it. I'm fortunate to be able to have 2 weekly calls with the Southeast region of this ACL. And we share ideas, and we're putting our heads together because isolation is something we do want to end just as quickly as we can. And y'all excuse me, but one of my earphones just fell out, so let me get that. But that was all I had to report.
And Ms. Pritchett?
Yes, thank you. I have to agree with both of the ladies. We are encouraging everyone to stay safe and careful, to pay attention to what the CDC is saying, to be mindful that they are more vulnerable and that we are not through this yet. So we, as an organization, we've canceled all in-person activities till July, and probably, we're suspecting that it'll continue through August, just to be safe for our volunteers and staff as well as our members. We want to be extra mindful of their health as well. We've had a big pivot, I think, like everyone else, to figure out how to do more engagements in a different way. Things like Zoom classes and the conference calls I've talked to you about, and webinars, connecting people virtually, to keep them, to reduce the isolation and to keep them educated as to what's going on and how to protect themselves. So that's our focus, is to keep that information free flowing and looking for new ways to engage and get the information going out, and then also hearing from people about what they're experiencing, so we can properly advocate for them and talk to you guys about it.
Representative Hall?
Yeah, so I guess my question would be to Anna, as we, and any of those participants. We hear about the seniors that Chanda talked about, the subsidized living, and many of them do not have access to the technology that we're talking about. So if you had your wish today, if you were allowed to just, have a wand and get your wish, what would you find, or what would you recommend that we should be doing to enhance the quality of life of those individuals who are even limited in their resources to have access to such services.
I don't mind speaking up. The first thing, you've already helped me get that done, Representative Hall, and that's testing. You know, these seniors are afraid. They are afraid that they're going to die, and because it's independent living, there's no records of next of kin. They're afraid that they're going to get sick, and nobody will even know what medications that they're on. And so AARP gave us some good calendars to go in and capture some of that emergency contact information. But Representative Hall, you helped us to get testing done. I think that just like if someone was going into an assisted living or a nursing home, they have to have a statement saying that they're free from communicable diseases. Specifically, TB tests are done on every healthcare worker. I think every healthcare worker needs to be tested because they could be asymptomatic. And if they take it into that nursing home, even if they're employed there, you know, that's what kind of baffled me a little, because we were only letting the employees in, but we weren't necessarily testing them. And so I would like to see the healthcare workers, the home care aides tested. I'd like to see these independent high rises being offered testing. We have a testing that's going on right now at one of the Huntsville Housing Authority complexes. I'd like to see the other 4 independent living high rises offered tests if they'd like to get those, because that's what we're getting hit with every week. Is just the fear is enormous. There were 3 positive tests in this one community, and they're very social. So they're staying in, no one's coming in, but they're in and out of each other's apartments. And so testing and for the professionals and testing for the individuals, that would be my wish.
Good, thank you.
All right, we actually have a question from Representative Drummond. Representative Drummond, I think you're unmuted, and fire away with your question.
Well, my question is actually for, I think, Mrs. Pritchard, but others can answer as well. Since this pandemic happened, I've had a constituent call me, and Ms. Pritchard, you talked about senior fraud, and this individual who called was a grandson who found out the grandmother has been sheltered in place, but the young granddaughter has gotten her card and has actually gotten about $4,000. So I'm trying to direct them as to what they can do to recoup that money and how can we remedy that problem in the future. Can you talk a little bit about that, please?
Yes, ma'am. Thank you. We work quite a bit on fraud and financial exploitation issues. I would send them straight to Adult Protective Services to get started with Mrs. Drummond and talk. You said they were a hold of her bank card. Was that right?
That's correct.
And you can talk to their bank, her bank, but there's certain procedures, and we have the Fraud Watch Network and tip sheets online. I'll be glad to send them to you. We're seeing, you know, with all these stimulus, all the talk about the stimulus money and everything coming back and people getting their money coming to them, there has been an increase. And we're, I believe, about to have a Monday night, we're having a teletown hall with Joe Borg and the Attorney General talking about and fraud and the resources in the state. But I would start with Adult Protective Services for sure.
Can you talk a little bit about what those resources are now in the state as a policymaker? Is there something that we need to do or that we need to prepare for in the future? Because they're not only vulnerable to COVID-19, but they're also...
Yes, ma'am. In fact, in this last session, we had the Bankers Association had promoted a bill that allowed banks to either delay or even deny transactions that were suspicious. They go through a great deal of training to identify them, and then also creating a trusted resource list that would give them approved people to talk to when they are suspicious. So I think that's a good first step. And I'm hoping that when the special session comes around that we can talk about that legislation as a reasonable way to move forward. There's always, you know, new ways for folks to be taken advantage of, and we're happy to identify those ways and work with you guys to do that. I also think, oh gosh, I'm sorry. There's so many things going in my head. give you the resources. The district attorneys are good resources. Your banks are good resources. We have the Fraud Watch Network on the AARP website. It lists different things and actually allows you to report suspicious frauds, or if people are concerned that they're being defrauded. There are trained staff people and volunteers working through the AARP Fraud Watch Network. I was looking for the number. I have it on here.
Who is Adult Protective Services? You mentioned that at the beginning.
They are through the Department of Human Resources. They are only state funded, so I'll remind you guys that they could probably use a boost as the older population is only getting larger, and was it 1 in 3 Americans are over the age of 50. Adult Protective Services are the ones who do those interventions, either through elder abuse and such. And you guys in the aging community, Commissioner, if you have something to add, but I know, for instance, when you're in a nursing home, you have the long-term ombudsman who can intercede for you and work with your family. But when you're out in independent living, you have to depend on other organizations, and they're all a bit, it depends on what exactly is going on, as far as, was it through your bank? Were they, a home care workers? And there are some protections that we could probably work on. Like about background checks.
Okay, and if I may, I'll jump in. I want to let you know that a few weeks ago, Department of Senior Services did a press release that dealt with fraud and scams targeting seniors right now. There are a couple of areas. First, there's the COVID scam. Oh, we have a cure, or oh, we have a test. And then there's the stimulus money. And then there's also Medicare and Medicaid fraud. We caution people, as we always do not give out your Medicare number to someone over the phone. Treat that information very carefully, hold it tight. But that was one thing we were able to do, is get a press release out, just warning people about this is a very, I think it's a very easy time to prey on seniors. Again, so many are alone. They may not have anyone to talk with right now, and they get a phone call and they might just start talking because they're lonely. So we have definitely tried to address that issue through our press release.
Yes, Commissioner.
Thank you.
One more, if I may say, I have the phone number for the AARP Fraud Watch Network helpline. It's toll free, where you can report a scam or get help if you think you're the victim of one. It is 1-877-908-3360. And then I also wanted to mention, we're working with the Law Institute. We get a lot of conversation. I hear a lot about guardianship issues here in the state, and there's actually we're working with them to produce, or working on the model law that's been recommended from the Model Law Commission to update our laws around guardianship issues, and that will also be helpful.
Okay, thank you.
Yes, ma'am.
All right, I have another question from the panelists, from Eddie Burkhalter from Alabama Political Reporter. And can the panelists discuss mental health among older Alabamians and what's being done to address access to care during the pandemic?
We've done quite a bit of crisis care management for those with mental health issues. And unfortunately, in many cases, we've had to go outside of the state to get them immediate treatment for those with geriatric mental health issues, because what would happen is, if you get one COVID diagnosis in the geriatric psych facilities, they would stop admissions temporarily. And so most of them are opening back up now. Here in Huntsville, we're able to either get them into the hospital or get them into geriatric psych in Huntsville or Decatur now. But there were windows there at the beginning where we had to look at Tennessee for options. The options have also been very challenging for the veterans. because your veterans crisis psych programs had pretty much come to a halt with COVID, but we were seeing the mental health flare-ups very significant, again, because of just you have a lot of paranoia with the paranoid schizophrenics and other mental health issues. And so just knowing that there was this thing going on called COVID, it became a CIA crisis, and we've just seen the gamut. Things are starting to settle a little bit more now. The other challenge was, if we got them into acute care, what to do with them next, because it was difficult to get them stabilized from a mental health perspective, and then to get them placed, because no one was accepting on the other end without quarantining them. Then how do you quarantine somebody with mental health issues? So I think definitely this has created a dialogue that we're going to have comprehensively. The good news in Madison County is that our probate court never stopped doing emergency guardianships and commitments if necessary, but once you committed them, there was nowhere to go. And so we definitely need to have more conversation around what happens when the creek rises, because we were not prepared for those with mental health issues once everything had to shut down. But I will say that everyone, the professionals, were just really creative with trying to put interventions in place, but it definitely has been a challenge.
Commissioner?
Well, I think we are all hypersensitive to the fact there's no shortage of stress these days. When you look at a record number of unemployment claims filed in just a 6-week period, when you look at the uncertainty of jobs, when I can't even consider what it would be like to have a parent or a relative in a nursing home right now and not be allowed to visit, not being allowed to visit a sick family member. So there's certainly no shortage of stress right now. And I do want to commend the legislature. I know you gave a budget increase to our Department of Mental Health with Commissioner Lynn Bashir, so that we can build 3 additional mental health hospitals. Of course, we don't have that now, but you have taken the first step by giving that department much needed funds. One way we are combating the stress of loneliness is that a lot of our AAAs have started phone trees, since they can't do their normal jobs at the senior centers. They're forming telephone buddies, telephone relationships, just hearing another voice. How are you? What was your day like? Can go a long, long way toward relieving the stress of isolation. And that's one thing that has been successful right now.
Ms. Pritchard, you have anything to add?
Just a few. I think Chanda and Mrs. Hall and I have worked quite a bit with Alzheimer's Task Force in the past, and I know it's now been moved over to the Department of Public Health, and it's needing funding for education, and I'm not sure where that fell in the budget. I do commend the work that the Department of Mental Health has been doing. The governor has done a good job at relaxing some of the restrictions on some of our providers so that they can get out and get to more people through telehealth mechanisms or working through systems in the Southeast through those group practice acts, or where they can practice across state lines through telehealth. I do think the stress and anxiety is very high. I worry if you've ever been a family caregiver. I know personally my mother is taking care of my dad, who has some dementia, and trying to take care of him. Getting people in and out to help care for him is particularly stressful, because the systems and the number of professional or community providers and that network out for home care workers is just not there. And so I think there are workforce issues that we need to accelerate along mental health issue lines and care workers. And I think we're doing what we can to promote virtual visitation in the nursing homes, both locally and nationally, where you know, even if it's the opportunity where you can have your loved one in the nursing home, and it's a little bit of help from the facility, getting on those iPads and talking to them through Facebook Live. And I know that they're working hard on getting those reports, but the level of stress and anxiety, I think, is just phenomenal.
Yeah. All right. I don't want to turn this into too political conversation, but I know we've all heard about the coronavirus money, $1.8 billion that's been given to the state of Alabama as part of our general fund. And, you know, there were there was a wish list, other things that were presented to the governor about what we should fund and what we shouldn't. So in order to shift that conversation, I want to ask each of you, you know, with that $1.8 billion, based upon your areas, your primary areas of concern, what are your needs so you can help inform us and the public of, you know, better places for some of those funds that are coming from the federal government?
Okay, I'll be happy to start on that one.
Yeah.
Since the Alabama Department of Senior Services is our state unit on aging, then we had some of those federal dollars. I believe it was a little over $12 million came straight to the Department of Senior Services so that we could follow very strict guidelines of ACL. But I would like to tell you some of the things we're able to do with the money that came straight to my department. And then there is a federal formula for distributing those funds to the AAAs. But I was extremely excited, especially when, you know, there for a while, we were just in fantastic shape until the virus hit. And then all of a sudden, we heard our finance director talking about all of a sudden we weren't going to have the millions of dollars in surplus that we had been thinking were available. So I was extremely excited when I learned that we can use some of our stimulus money to provide nutrition for our seniors. Now we have the flexibility, since there's been a major disaster declaration, to buy groceries for seniors. We can use some of that money to have a grocery delivery company. I won't name the ones, but y'all know the apps that are out there where you can order your groceries, have them delivered to your home. We can use the stimulus money for that. We can use the stimulus money for the protective equipment. So this has been a huge help to my department and to the AAAs throughout the state, because we've been, as I say, we've been given strict guidance from ACL, and we in turn have provided FAQs for all of our county AAA directors. And that stimulus money is a tremendous help, and we are very thankful for it.
Ms. Crutcher?
You know, three things pop in mind. One is just to make sure that we're having the conversation necessary to prevent duplication of services, and not just duplication in the purest sense of are we serving the same people, but a bigger question of are we serving those who don't know how to be served or get to the service? Because I still see significant gaps in socioeconomic environments and seniors that don't know how to access that, just the basic information. So the things are there, but they're just not getting to it. And we have to take it to them. And that includes those who are in line for services. So as a part of the Alzheimer's Task Force, we went all throughout the state and talked to the different counties. And one of the commonalities was that there's usually a waiting list for Medicaid waiver services, which is a wonderful program. But I think in times like these, those that are already in the door, they're going to be served really well. Our AAAs have done a phenomenal job, but those that are still in line and have not quite made it through the door, I think we've got to go address those that are on that waiting list, because they are impoverished, many of them. They've been identified to have a need. And so we've got to figure out programs. And I'm so excited about partnering with our local AAA, Renee Breland, thanks to Commissioner Brown, to address that waiting list. But I think that should happen all throughout our state. We need to identify those who have not yet made it onto Meals on Wheels are those that have made it into the programs, and make sure we're getting to them. And just education in ways that they can hear it and see it, because they don't have access to the internet. They're not going to read the printed information. And so we've got to be really creative as to how we get to the least of these.
And Ms. Pritchard, do you want to help inform us of what you think our priorities should be with our coronavirus?
Well,
Yeah, so there is a very said Pritchard, I'm sorry. I was thinking, can I say one more thing, Anna? Just one more quick thing?
Yeah, go ahead.
We've got to decide on what our standard is for these subsidized senior living communities. Yes, they are independent, but they're only independent because they can't afford assisted. And so we've got to reopen that conversation, because I do missions overseas quite a bit. And what I've seen these last 7-8 weeks is worse than anything I've seen in many third world countries as to how some of our seniors are aging. And so we've got to have a conversation about a minimal standard for independent living subsidized housing. And I'm sorry.
And I'm going to jump in, Mr. England, but I agree. I think it's, and we've been talking about this all along, that spectrum of care needs to be addressed. And it's not just the Medicaid eligible, it is long-term care all the way through. It has been many years since we have talked about that. The aging population is exploding, and this is just showing where those big holes are. I think we take the cap off of the slots for the ED waiver.
Yes.
Elderly and disabled waiver at the home and community-based services. We have had, up until this year, we've had cuts every year in that program, which is ridiculous, and it has a very high federal match rate and really makes a difference, and it keeps people out of the nursing home that don't have to be there. I think respite for caregivers, like I'll go back to the whole, if you've ever been stuck in a house taking care of somebody with dementia, you know, it's a lot. And in order for you to stay healthy and help take care of that person, respite means everything. So I think access to broadband is important. I think them being able to vote safely and not worry about being contaminated and getting sick is very important. So I think those are the ones that come right off the top of my head. And I think a lot of it comes around that larger conversation that we, like what we did, Chanda, with the Alzheimer's plan, state plan, we need to go back to for long-term support services. I think that has to be comprehensive. It has workforce issues, mental health issues, all of it.
And speaking of workforce, we've received a question from someone watching on Facebook and asking about returning to workforce. And one of the things that was identified is about, is there a plan to start testing those who are returning to the workforce in assisted living homes, senior centers, and so forth? Have you heard anything about those?
I have not. I don't think all of our hospital workers are being tested regularly. I don't think
I can tell you that I receive phone calls from home care aides and caregivers on a daily basis saying, we've been begging for testing. We want to be tested. Home care workers are afraid to push the issue because they need their jobs. These are some of the lowest paid employees when it comes to healthcare, but they're the ones that cannot social distance. You can't social distance and give someone a shower, or social distance and do incontinence care. And so they want to be tested, but they're fearful. And I think if we're testing people and requiring them to pass a TB test, that we should definitely be testing them for this virus during this time.
So that sounds like something we should be spending our coronavirus relief money on.
Yes,
most definitely.
Absolutely.
And also, Commissioner, you identified mechanical pets. Is that also something that we could use coronavirus relief funds on?
Yes, to alleviate the loneliness and the despair. As I said, I've heard nothing but good reports from Florida and New York, which both have large elderly populations. And I'll be frank, when I first heard about the mechanical pets, my first reaction was that that's a poor substitute for for a human, an
Yeah.
actual human. But then as I started thinking about it, number one, for under $100 per pet, if we can prevent loneliness, sadness, despair in a senior, or help someone with dementia be less agitated, and I have, as I say, a small amount of federal dollars to use for that specific purpose, then I say let's try it. It certainly seems to have worked in Florida and New York. And as far as I can tell, Alabama is being quite innovative. I'm not aware of any other southern state besides Florida that has latched on to this idea, but it got my attention early on. And one of the companies sent me to Robotic Pets to kind of do a test drive. And they're quite adorable. But as I was saying, although I at first thought it was kind of sad, we were substituting a pet, a toy pet for a person. We're not really substituting. There is no substitute for human to human interaction. But I realized everybody has toys. Children love toys. Adults love toys. You know, many adults are on their cell phones playing games a lot. And so why should it be any different from our older population that we provide them some toys? But I really love that little dog. The cat will scratch its nose. Its whiskers will, whatever you call, anyway, that whiskers move. And I think they're adorable. And as I say, if for under $100, we can make somebody's life happier right now, then I say, let's try it.
Okay, well, all right. First, I want to again thank you, and I'm going to give each panelist an opportunity. We've got a couple of minutes before the next panel begins, and so if you got just a couple of words, that whether you want to direct us in the appropriate direction on stimulus spending, or if you got other things that you think need to be on our radar as we move forward and try to make through this pandemic, I'll give you a minute or so to kind of wrap up, and then we're going to move on to the next part of our webinar. Commissioner?
Oh, thank you. Well, first of all, I do want you to know that it was extremely important to the governor and me that our front desk be open even when we began working remotely. Our people wanted to work at the front desk, and we continued that because I want to be sure that anyone seeking help from the Department of Senior Services reaches a live voice when they call this number. So I would like to give out our toll-free number before my time is up. But again, thanks to everyone, to Anna Pritchett, to Chanda. It's been a real privilege to be with you. So our toll-free number is 1-800-243-5463. Again, 1-800-243-5463. As I say, we have always had live people at our front desk. So if we can help you in any way, please do not hesitate. And then our website is alabamaageline.gov, alabamaageline.gov. So thank you again.
Thank you. Ms. Crutcher?
You know, I'd like to take my time to just highlight that we've got to advocate for those very proactively that are socioeconomically challenged and don't know how or don't have the access to advocate for themselves, specifically in subsidized living environments. We've got to rehab this long-term care conversation. Again, those that are, we're finding that a lot in the subsidized living environments, the only reason that they're not in assisted living is because they don't have the resources. And the only support for them, you know, they can get the Medicaid waiver or Alabama Cares to get caregiving assistance to come into the home, but it's a bigger narrative than that. And I just think we need to reopen that conversation, as Anna said. And when things like this happen, and hopefully we won't walk through another pandemic in our lifetimes, but we will walk through other crises, we've got to take into consideration those that are already not on the radar. We have some amazing programs in our state to impact the quality of life for our older adults, but we also have some significant gaps. And I think we need to come together and really discuss those gaps. I think we have the resources necessary to really do a bang up good job and set a national model for aging well. But we're not collaborating as a community as well as we could. But I hope that this pandemic, one of the positive outcomes will be us really doing that better. And I really champion Commissioner Brown, because she is really doing a great job of encouraging that type of collaboration at the grassroots level. And I feel like under her leadership that we will be able to have some of the hard conversations. But right now, the bleed out is happening with our veterans, with our older adults that are at or below the poverty level and in these subsidized independent living facilities. And I think that makes it easier to find them, but we've got to go get them and do something about it quickly.
All right, thank you, Crutcher. And Ms. Fisher, you get the opportunity and the honor of wrapping us up.
Oh gosh. Well, thank you again for including me. You know, I learned something every time we get on one of these conference calls. I wanted to remind everybody that 211 is a great resource within the community that people have access to, and to continue to make sure that they have the resources they need to connect people in your communities. I wanted to remind everybody that AARP is here and working, even though we're working remotely. We are here for you. We are posting all the time on social media. And then of course, we're welcome to keep up with us directly if you want to call. So thank you again, and we're here for you.
Thank you. And I want to say that it feels like we would probably learn more about what's going on if we just listen to you guys talk amongst yourselves and engage you in conversation more than anything else. So this has been absolutely enlightening. And again, thank you guys for offering your time today to us to help inform us and the public about the needs of our aging community.
Thank you so much.
Thank you so much.
And Representative Hall, are you there? Well, I will move us on. The next.
I am here.
All right. Do you want to get us going? Okay. All right. All right. One of the things that the pandemic has definitely exposed to the world, especially here in the United States, is that there are people who do not have access to basic necessities, such as food. And one of the more awful images that you see on TV as this pandemic evolves is the massive lines surrounding our food banks, which point to how close we are to just overall desolation and poverty. So I think it's an appropriate time to have a conversation about our food banks. And for that conversation, we've actually got two people with us. One is Laura Lester from the Food Bank Association, and also Kim Lockus. First and foremost, I want to say thank you for joining us. And if you could, introduce yourselves and tell us what you do, and also give us an idea of what you're seeing as you do your job in this pandemic.
Thank you so much. Hey, y'all, I'm Laura Lester. I'm with the Alabama Food Bank Association, and I'm here today with my colleague, Kim Lockus, and she's going to talk a little bit after I do. We work with 8 Feeding America food banks that work across all counties in Alabama. We partner with about 1,600 frontline agencies, churches, and pantries that help feed hungry families in our communities. So despite the fact that we distributed about 61 million pounds of food last year, our network of pantries was already stretched pretty thin before this crisis occurred. As a baseline, nearly 1 in 4 children in Alabama were struggling with hunger every day. We are very concerned of what that number is now, that the economic impacts of the pandemic are being felt everywhere. We've worked alongside our partners to mobilize every tool available to us, and additional organizations, other private charities, faith-based groups, nonprofits. We've been working alongside state and federal nutrition programs as well to try to fill the rapidly expanding gap in coverage. Because of the impacts of the pandemic downturn, more people are falling into poverty or deeper into poverty every day, and it's taking a massive effort to keep up. Children have lost their school meals that they depend on. Low-income families are struggling with lost wages, and our seniors are, of course, as y'all just discussed, more at risk than ever before. So at the food banks themselves, I know y'all have seen the stories. The warehouses have been rapidly depleted, then generously restocked, and then depleted again. It's kind of amazing how quickly this has been happening. You guys have seen the pictures of the cars lined up for miles, filled with folks who are desperate for help. One of the challenges for our food banks is that many of our normal sources of food just aren't there right now. For example, our food banks get a good deal of their food from grocery stores who donate food that's near its expiration date or it's cosmetically damaged. But as y'all can imagine, over the last 2 months, the stores have found themselves picked clean with nothing left to donate. And this is all the while phones have been ringing off the hook at the food banks, with many people dealing with food insecurity for the first time in their lives. I do have to say just that the food bank network and their agencies have been nothing short of incredible in their response to what's been happening. I also want to talk a little bit about the work we've been doing. We've been working closely with our partners at the Department of Human Resources and the Department of Education. I think these are really important to try to make sure we're utilizing every nutrition program available, as well as all of the flexibilities that are currently being allowed to help folks. I will say, as I mentioned before, one of our biggest challenges in the efforts in our work is to address lost school meals. More than half of the children in our state rely on free or reduced price breakfast and lunches, and sometimes after school meals. The good news is that the summer feeding program that currently operates during the summer is available to provide meals through school closures. And the Department of Education did a great job of applying for and receiving several waivers very early on to allow these summer feeding sites to operate now and do it in a safe way. So some of the waivers are that, for example, meals can be handed out in through a car window and not consumed on site, which is different than the normal model. Also, sites that are distributing meals can give out up to 5 meals at a time, and it can be for 2 meals for the day. So you can give out 5 breakfasts and 5 lunches at one drop off. So families don't have to keep coming in. And very importantly, schools that are doing meals or other sponsors, community sponsors, can ask for a waiver so children don't actually have to be present in the car for the parents to receive the meals. This became increasingly important when the kids had to go back to school online. So schools, as y'all know, are really our frontline defense against child hunger. And we've seen so many systems do some great work. I'll mention a few: Elmore County, Mobile County, Andalusia City, Decatur City, those just to name a few. Several systems did stop service in April, and we're hoping that some are planning to start serving meals again soon. And we have seen some come back on. There are community sponsors that have taken over in some places, and actually the Alabama Food Bank Association is one of them, but we're never going to have the capacity that the schools are. So we're hoping to see more come back online in terms of serving meals as we approach the summer. The other thing I want to mention is what's happened around SNAP or SNAP benefits or food stamps. Department of Human Resources has done an incredible job rising to the challenge. While they're dealing with about 150% increase in new applications for SNAP benefits, they've also had to make some huge adjustments to the program based on federal legislation. So for example, right now, they have suspended the 3-month time limit for benefits for adults who are under 50 without kids. They have expanded the maximum allotment of SNAP benefits per month for everyone who is on SNAP, and that was for March and April. And then most impressively, they were one of the first states to step up and apply for what's called pandemic EBT or PEBT. And this is a benefit for families with school-aged children who typically get free or reduced meals. They worked through this application and got it into USDA so quickly, and in fact have already been able to add benefits to SNAP cards for people who are already on SNAP benefits for those missed meals. And they've also been able to reach out to families who get free and reduced meals who aren't on SNAP, but can actually get a PEBT card that covers March, April, and May for their kids. So that's been really great to see. So, I just want to mention, the federal policies that have been changed to respond to this and the state work. It's essential. It's going to help us reach more people. But I also am hopeful that we're going to be able to keep this going. We know that we're going to feel the economic impact of this for a very long time. We're in this for the long haul, but the nutrition program flexibilities, increases in benefits, these are all the things that are going to make sure we can respond properly. So I'm going to turn it over to Kim really quickly. She's going to talk a little bit more about the food banks.
Hey everyone, thank you so much for having me today. I dropped a link in the chat box that shows our food banks and the territories they each cover. As Laura mentioned, there are 4 Feeding America food banks and 4 PDOs in our network, and they're all members and work through Feeding America. And the importance of this group is that they're managed at a very high, to a very high standard through Feeding America policies around food safety and food procurement and distribution. And they're also, them as well as many of their pantries are all monitored by the health departments in their counties. One of the things they want to make sure they're doing is distributing food safely, and the Feeding America Network has the highest standards for that. Throughout the country, there are 200 Feeding America food banks. Just a little bit of structure and how it works. Every county in the country is assigned to one of these food banks. There are 22 state associations. We are one of those, and very proud to work with our food bank leaders on policy and programmatic work that impact Alabamians. I just want to talk about a few federal and state things very briefly. There is a new program that has been created called CFAP. It's COVID Food Assistance Program, and it's essentially farm to food boxes. The bids for that program are being managed by USDA Agricultural Marketing Services. They were due Friday, I think it was the 8th. And they have just been awarded to vendors. We're finding out this week several vendors in Alabama and several vendors near that have the ability to serve Alabama were awarded those food boxes. By the end of this week, we should know how many of those will be coming into our state, and that's something we can keep you all abreast of. So that program is one that was designed for the distributors to directly give to community agencies that serve at the grassroots level and do food distribution. So many of our food banks and pantries and other nonprofits who maybe aren't affiliated with our network but work in hunger relief will also have those boxes available to them. And I just wanted to piggyback off of what Laura said regarding the summer meals program. That is an amazing program. We are at 7 weeks in for operating. We have at any point between 25 and 30 sites, depending who is operating that day or that week. We will have distributed 45,000 meals at this point. And as a point of reference, last summer, we distributed 60,000 for the entire summer from May to August. So we're doing a lot, and there's a lot more to come. We're working with our vendor and with the state office to increase capacity. One of the things we don't want to see happen that we're very worried about is families have received their stimulus checks. They may be receiving PEBT, but when those funds run out, we want to make sure there are still summer feeding sites open that are serving communities across the state. So we're serving many rural communities right now, from Sumter County. We have, our first time we're serving that county, and looking out across to Bibb and Greene and many counties in our East Alabama area as well. But that is where we are right now with our summer meals. We're offering lunch and snack items, but many vendors across the state are having a hard time addressing how they're going to continue serving curbside into the summer. And we're working to figure out what normal sites, Boys and Girls Clubs that operate camps or churches that have Vacation Bible School, who will be open this summer. Will congregation of children be happening? And if so, how do we connect those folks with meals? And if there aren't congregations of children happening in communities, then how are we going to get curbside pickup meals in those communities? So that's a lot of our focus right now, just to make sure there aren't gaps and that there's equitable access. And I'll turn it back over to Laura. Happy to answer any questions anyone may have.
Thank you. That was perfect. And I guess the only other thing that we would mention is, the resources that are available to folks. Obviously 211 is a great resource. We also have a website, alfoodbanks.org. And on that site, you can link to all of the different food banks in Alabama, and they have food finder maps. So you can put in your address and find out where the closest agencies are to you. I will also say, in terms of helping folks find the summer feeding sites that are operating near them, Department of Ed has a website called breakforaplate.com. That's also a great resource. And the last thing I'll mention is, to encourage as many folks as possible who think they might now for the first time be eligible for SNAP benefits to apply. Our food bank in Mobile also does run a helpline in terms of helping folks apply for SNAP benefits. And that's also a great resource. So, and we can send out all that information if that's helpful to y'all.
Representative Hall, do you have anything? All right, so because we have so many people that are now newly.
I am unmuted.
All right, you have a question, Representative Hall?
Yes, I wanted to talk about, thank you, I'm sorry, that we've had concerns raised even through the NAACP as relates to children not being fed or not having access to free food. Could you address how you all are addressing that, or tell me what is it that we can do to make sure that that issue has been addressed or will be addressed?
Sure, and I know that there was actually, the NAACP got involved in a county, or an area
Leeds.
outside of Birmingham. Where is it, Kim?
Leeds.
Leeds, thank you, outside of Birmingham, to try to get them to start their summer meal service back. And that Leeds then did come forward and say, we will start our program up again. And again, I think that some school districts have been able to find community sponsors to step in and help out with that. Birmingham City and Jefferson County are good examples. There's a private community sponsor, Kickstart, that's managing those. But as I mentioned earlier, the concern that we always have is the capacity of the community sponsors. We're just never going to have the ability to reach as many kids as the schools will. And so what we would love to see is there's some great best practices out there. I mentioned several of the systems that have been operating since the schools closed, serving so many kids. And I think that if we can help focus on those best practices and help encourage districts and schools to start serving curbside meals again, I think that's going to have the biggest impact overall. Kim, do you want to add to that?
Absolutely. I would say the Department of Education has adopted all eligible waivers. So this program is as easy as it's ever going to be to operate. But I would say just with summer as a whole, in a normal summer program, not related to COVID, summer meals are only reaching 20 to 25% of the kids that are normally served by school lunchrooms on free and reduced lunch. So there's a very large gap already as it relates to the summer meals program. Not all of the schools in our state operate that program during the summer. Only a fraction of them do. So there's some, I think, educational gaps for the districts on what this is, how they can utilize it, what they actually have to do now that the regulations have been adjusted to respond to the COVID crisis. So I do think educating districts on the program and what it is would be helpful. I think that any resources the Department of Ed could provide, they've done an online training that they're sharing. They're working with districts to make them aware of those things. I think understanding that it's hard right now to get food. It's hard for our food banks to get food in. How the food, just food sources in general have been disrupted by this has been really hard for people. So understanding that some of it is they can't get the things they need to be able to serve. My hope would be that they're all working to come back for the summer. Folks who normally haven't operated the program should and could be at this time planning to come back and to work with their vendors on getting food and work with their staff on a plan to serve meals for the summer. I would say another thing that's really helpful is promoting the Break for a Plate website. There are a lot of sites that are open right now and serving meals, and families in Alabama just they may not be aware of how to find those.
What was it?
I dropped the link in the chat box, but it's breakforaplate.com. And there's also a free texting service. You text food to 877-877. And then you send your zip code in and they send you the sites near you. That's another great resource. So not just educating the school systems and community sponsors who could be doing this, but also educating families on where they can find those meals and that these meals exist and can be a resource for them, I think is very important. And those meals are for any child ages 18 and under.
I think the one thing that I've heard has been that having the school systems with everybody being sent home, there was no staff to prepare the food in many places. Are you seeing that as one of the issues as well?
I think each district has to manage their staffing abilities on their own, but as Laura mentioned, there are fabulous districts across the state who have figured it out and who are getting meals to kids and have made it a priority.
Thank you.
There's also the option that schools have if they want to continue serving, but they don't want to bring back in kitchen staff, is that there are ways to get food from different vendors to get shelf-stable meals. We work with a vendor, for example. So I think there are some creative solutions that are available for school districts.
Thank you.
Good. If any of our members have any questions, please feel free to chime in. But I think it's important for all of us to understand how you're primarily funded. And could you just kind of describe that for us?
Kim, do you want to do?
Yeah, absolutely. So we are funded through 3 different streams: grants, federal program, which is we operate the summer meals program. That's a zero-sum game for us. We actually raise grant funds to be able to cover our salary costs with that program. And then, so member dues, grants and the one federal program that we operate. Our budget is just under 500,000, and a majority of that is the federal meals program that we operate. We have 2 staff members, Laura and myself, and in the summer we add an additional 2 to 3 interns to help with paperwork and monitoring responsibilities as part of the summer meals program.
And the food banks themselves also rely on different sources of funding and food. So again, there's private funding, there are traditional food drives, there is the grocery store pickup program we mentioned earlier. They also receive what we call the Federal Commodities Program, or TFAP foods from the government that they then distribute out to their agencies. So again, there's a number, private funders, there's just a number of different resources.
Okay. And could you also, as legislators, state legislators, how we can help you, and in term, not just in terms of where we are now, but obviously this isn't going anywhere anytime soon. So how can we help you now and in the future?
So I would say first and foremost, what you're doing right now, which is shining a light on the issues, which we really greatly appreciate. Again, when we think about where we were at in terms of hunger and poverty in Alabama before this hit, and where we're going to be in June or August or in the fall, I just think we aren't sure. Just getting the word out to your constituents about what's available, supporting the work of the food banks, helping strengthen the nutrition programs like SNAP, like school meals, working with the state agencies in terms of coming up with creative solutions for the delivery of summer meals, for example, those kinds of things. And Kim, I'll let you.
No, I agree with all of that. I think a lot of people are anticipating more shutdowns in the future, or whether that's statewide or just a community where there may be an outbreak. But making sure that in those discussions, before a decision is made to put an order in place or to put a community on lockdown, making sure that access to meals for children is an important factor in what's happened, so that those communities have engaged their school systems and their community-based sponsors to say, how are we going to feed kids through this? And I would also like to say, Laura mentioned this, but our food banks are having to buy a tremendous amount of food right now. That's typically not the case. One of them said that they bought more food, purchased more food in the months of March and April than they did in all of 2019, because a very strong part of their food sources are donations from stores and community food drives. So just knowing that our food bank network in Alabama is in it for the long run. We are doing both short and long-term recovery as the economy continues to restabilize. Hopefully there are going to be people who have lost jobs and income, and that's going to take a while to replace and get their families back on their feet. And our food banks are going to be there to serve them. It's not just a short-term response right now that they're all planning for. So knowing that funding issues may arise down the road, that's something I would say you all may have the ability to help with. But more than ever, just continuing to make this meals for families, meals for kids, just meals for all Alabamians that are experiencing food insecurity, making that at the forefront of any policy decisions that are coming out around shutdowns or lockdowns, close down, stay at homes, whatever we're calling it. But just making sure that that is part of the conversation, so things aren't just shut down and then folks are scrambling to understand what the food sources are going to be for their families. That would be my hope, that we could all work towards for any future issues and disasters and things of that nature.
Thank you. Representative Hall?
Is there anything that's if you have those flyers or anything that we can use in our social media to get out the information about your program, I think that would be helpful. It would be for me.
Absolutely.
So we look forward to that. We're grateful for the time that you spent with us and putting the spotlight on an issue that we know is important to all, and especially to our legislators. So thank you so much for being a part of this discussion, Representative England and Representative Daniels.
And I want to echo that. I've run into more people recently who are in a panic, who are newly unemployed, who were not expecting this, who I thought they were working in a relatively safe position despite our current crisis, and are now looking for ways to take care of themselves and their families. So I echo Representative Hall. If you can help us, we'll do whatever we can to disseminate this information to make people aware that not only the resources are there, but if you're capable of supporting our food banks, you should do so as well. So again, I thank you for offering this information for us. It's one of those things that's critical in the times that we're in now. Representative Daniels.
Thank you to Representative England and Hall for once again doing a fabulous job co-chairing our education sessions and sessions on. We have more questions and answers, and so certainly thank the panelists for their insight, both Kim and Laura, for all that you do to make certain that the voices of those that are in need are heard. And so thank you for that. And thank you to our listeners that are on Facebook. We have some of our members that are listening in on Facebook that I noticed, and also the members that are present on Zoom. Thank you guys for your participation and the things that you do to serve your community. And again, the work that you do on a day-to-day basis, whether it's in your district or also educating the public at large on the needs of our state, and that you're doing everything that you can to make certain that we take these recommendations and the information that's being provided to us back to advocate for those that are less fortunate. So I want to thank the members and thank our staff for once again doing a tremendous job of putting this together and finding our speakers and making certain that you're putting everything together and that the train is running on time. You guys have done a fabulous job. With that, Mr. Chairman, I that's all I have.
All right.
Thank you, everyone.
We will be back tomorrow with another webinar. The agenda will be distributed this evening, and we will make it known to the public what we're planning on doing tomorrow. So with that, if there isn't any, excuse me, the agenda is on the screen. I apologize.
Yeah.
So I sound like a television host, but tune in tomorrow o'clock to hear medical expert Dr. Michael Sack, who is one of the preeminent epidemiologists across the country. We'll spend an hour with him. We'll also spend 30 minutes with our Commissioner for Mental Health, Lynn Bashir, as he answers questions about mental health during this pandemic. And then also we'll hear from a community that has been hit hard in this crisis, our veterans as well, from 11:30 when we'll hear from our Commissioner, Kent Davis. So if there's nothing else, I think we'll go ahead and wrap this up, and hopefully we'll see you back here tomorrow morning at 10 o'clock.
Yay.
Thank you.
Good job. Love it.